Hello, and welcome to the final part of Session 6, Week 6 of Naturopathic Philosophy. And we're going to touch back into the concepts of, or the ideas of spirituality in medicine, again, briefly here at the end of this bit. This is from an article or book, article called Spirituality and the Medical Encounter. And the quote is, "A way to step into practicing medicine as a spiritual encounter is to listen for the meaning of a patient's experience instead of listening only for the reporting of symptoms." And so this is written by a naturopathic doctor in the United States. So it's from the perspective of practicing naturopathic medicine in that setting. And it touches back in on what we were discussing in the prior part with regard to integral theory and listening not only for the symptoms that the patient is telling you about, but what is their subjective experience of that? What is the meaning of that for them? So that's circling back around to the topic that we touched on when we were studying the healing power of nature and talking about spirituality in medicine. And looking at a person's spiritual nature and their beliefs as an aspect of the whole of who they are is part of a holistic approach to medicine, or whether it's conventional medicine or alternative medicine. So the naturopathic principle we're addressing in this week is stating explicitly that naturopaths address spirituality as an aspect of their patient's experience of life. And whether or not a naturopath views spirituality as an aspect of the healing power of nature or vice versa, or doesn't at all, it's clear that spirituality is an aspect of holism that most patients wish to see acknowledged within the healthcare setting, which we saw a couple of weeks ago when we were talking about that. And to do that, to include spirituality as part of the medical encounter, and just to clarify, we're not talking about religion, we're talking about addressing the patient's experience of feeling a part of something larger than themselves, whatever that is. That requires a level of comfort with this on the part of the practitioner, and gaining that comfort generally calls for a personal exploration by the practitioner of what their own beliefs are and exploring how to address that in a safe and non-judgmental and really open way in an encounter within a naturopathic visit. So as Dr. Sutherland points out in her article, including spirituality in our visits with patients doesn't have to simply take the form of having a discussion with patients about their spiritual beliefs and practices. It doesn't have to be that overt. We can also just step into the patient-practitioner encounter itself as a spiritual experience. So we can be the presence of spirit in whatever way we envision that, without even having a conversation with the patient about spirituality in an outward way. We can simply reflect on what they're telling us about their experience of life and the world. And here's a few ways that we can do this within naturopathic practice. Naturopaths can practice as a spiritual encounter by cultivating an awareness of their own wholeness. And this is a vehicle for addressing wholeness in your patients. Seeing wholeness in the patient, which means the naturopath seeing the patient sitting in front of them is not looking at this person as broken. Not looking at this person as if there is something wrong with them, even if they are experiencing some things in life at this stage that are negative, such as pain or discomfort or other symptoms of illness. A naturopath seeing a patient in their wholeness and their ability to move back towards a state of balance can be a way of bringing spirituality into the encounter, in the visit. and then connecting from our own sense of wholeness within ourselves as a practitioner to the sense of wholeness we perceive within the patient. So these are all strategies that are discussed by Dr. Sutherland in her article, and this is really built into taking a holistic view of a patient and building that holistic view or manifesting that holistic view in a spiritual context, but without having an explicit conversation with the patient about their own spirituality. So I mentioned that this section would be brief. I've just got an ending quote, as always. This one from Michael Crichton, who's a science fiction author you probably are familiar with. Complex systems seem to strike a balance between the need for order and the imperative to change. Complex systems tend to locate themselves at a place we call the edge of chaos, a place where there is enough innovation to keep a living system vibrant and enough stability to keep it from collapsing into anarchy. It is a point of conflict and upheaval. Finding the balance point must be a delicate matter. If a living system drifts too close to chaos, it risks falling over into incoherence and dissolution. But if the system moves too far from the edge, it becomes rigid, frozen, totalitarian. Both conditions lead to extinction. Only at the edge of chaos can complex systems flourish. And I love this quote because it reminds us that when a human organism is really striving to flourish, sometimes it is uncomfortable and a bit messy, and moving towards a state of flourishing is often moving through a healing process, healing things that have held us back in the past. And we need that discomfort, we need to go through that discomfort in order to move to another level, because there's a disruption of our familiar habits or our surrounds, enough that pushes us to a higher place if we step out of that familiarity. But moving through into a state of something, a new state that's not familiar, can be quite uncomfortable and sometimes a little bit scary. And that's true whether it's physical, mental, emotional, or spiritual. Healing doesn't happen by a magic pill or a silver bullet when we look at healing through a holistic view. It's often chaotic and it's almost never linear, which is very important to recognize, and I've made reference to that in prior weeks. And we have to honor the nature of the chaos within the whole, because it's the force that helps us grow and heal. The interesting thing about this quote is this quote is not actually about medicine and the human healing process. But within this quote, I see a reflection of the Chinese philosophy of yin and yang. If we talk about yin and yang being out of balance, and we'll talk a little bit more about that next week, if yin is in excess, then things don't move forward, and if yang is in excess, things can move forward either chaotically or too fast. So in this quote, I see that philosophy reflected as well. So that's it for this week. I will close things up with a clinical pearl, as I usually do. The one this week is a homeopathic first aid suggestion for insect stings and bites or puncture wounds. And with that said, with regard to puncture wounds, if you get a puncture wound from something dirty and you haven't had a tetanus shot, that's generally an important thing to keep in mind. So I'm not saying that you should not go get a tetanus shot with a puncture wound. But homeopathically, in addition, if you have a puncture wound, but also predominantly for stings and insect stings, when the sting is hot to the touch and red and swollen, such as oftentimes when we're stung by a bee or a wasp, that would call for Apis mellifica 30C potency for an acute sting, and Apis mellifica is actually bee venom. And for stings and wounds that are cold to the touch and might be blue or bruised looking, as sometimes we might get with with different types of insects, the proper remedy homeopathically would be Ledum palustra 30C, sorry. So that's just a little bit of homeopathic first aid. So this week for tutorial activities, you have a discussion forum, as usual, a list of questions to discuss on the forums. I would encourage everybody to please participate in these discussion forums. Really great to read everybody's reflections on these questions. It's a fantastic discussion that's going on. And also this week, a tutorial activity, there is a meditation on multi-level awareness. And so I encourage you to do that, find a quiet place and do that meditation for yourself this week. And you can also reflect on that in the forums. Okay, thank you for your attention, and I'll see you next week.